So are you okay if we start, Bill? Okay. All right, Tina?
Yep,
You
we're good.
All right. Oh, hang on. Hi there. You are. I can't take you off.
Okay, no worries. He said he'll be there in 10 minutes.
Okay. So we'll go ahead and start.
Sounds great.
Thanks. Bye.
You're welcome. Bye-bye.
Okay. Okay, welcome everybody. We are here with a special meeting agenda with Panhandle Health District. It is May 3rd, 2022, and it is 10:07 a.m. I'm calling this meeting to order. Attending are Commissioners Duncan and Brooks, and Chairman Filios is on his way. Are there any changes to the agenda? Okay, hearing none. We'll step right into the annual Panhandle Health District Review with Don Duffy, our District Director, and then also joining him is Christine Crummer.
Great. Commissioner, thank you so much. It's great that we appreciate the chance to be with all of you. Thank you for your service and listening to us today as we go over our budget. As you know, this gives us the opportunity to present our budget to you. There's no action that will be taken today. That will happen on May 26th at our budget hearing at 11 o'clock at Panhandle Health District, where all counties will be represented by a commissioner, and then the vote will be taken regarding our budget. But this gives us an opportunity to go over it with you, and most importantly, answer any questions that you might have. So I'm going to give a short kind of a summary of what's happening with our budget and a little review some of the services, most of the services that Kootenai County is utilizing at Panhandle Health District, and then I'm going to turn the time over to Christine to give you a excellent detailed review of our budget. Just in summary, what we're asking for today is, or we will be asking for on May 26th with our budget, is a 3% increase. And I want to remind you that that is 3% of the general aid. So 3% of 10% of our budget is what we're asking for. And that total is $37,133. And of course, that amount is shared amongst all 5 counties. But of course, as you know, our budget, the allotments, the assessments are based on population and valuation. And that's grown significantly in your county. And so Kootenai County will pay a large share of that $37,000 increase. We're asking the Kootenai County to pay $30,159. Our overall budget, if we remove all of the funds that went through Panhandle for the COVID response, if we remove that so we can really compare apples to apples, our budget from FY2021 will increase from $12,662,569 to $13,029,778, or our budget will increase by $367,209 going into the upcoming fiscal year. One particular highlight on our budget this year is that we're having an 8% salary increase. So you'll see on the budget, salaries and benefits are increasing by $687,020. And we're dealing with the same thing that you're dealing with. If we look at the first quarter of 2021 to the first quarter of 2022, we had a turnover rate that increased from 2% to 10%. I take the opportunity to interview every person who's leaving, our exit interviews, and in every case, it had to do with salary. Salary increases from $5 to $10 an hour. So we had to do something. We're losing very capable people to higher paid salaries. The way the health district does our salaries is we use a formula called 80% of policy. The state of Idaho sets the standard of what these pay rates should be, and policy is considered average. So for years, Panhandle Health District has paid 80% of average. So when a new employee comes in, we do the calculation, and we're paying them at that 80% rate. We have increased that to 90% of policy. At least that's what we're asking today. And that's brought those salaries up. We're still only 90% of the average, and we're hoping that will stem the flow of staff leaving, at least to some degree. And that's where you see that $687,000 increase in salaries. And of course, there's inflation that's at 8.5% right now and ever growing. We do a lot of traveling, so gas costs are expensive to us, as well as all of our medical supplies. Everything, as you so well know, is going up substantially. In all honesty, I'm quite proud of what we've done. With all of that, we're only asking to increase our budget by $37,000. And some would ask, how are we able to do that? Certainly, we've had revenues that have increased. We've had increased in grants and some fees that we've increased to help to compensate for that. But our management team has done an excellent job with our staff. We have at least 2 supervisors that we're not replacing. We have a number of positions that we're going to try to do it without them. We're going to try to find that efficiency with those, and that's a significant savings for us going forward. So I'm quite pleased that with this significant salary increase, we're asking for a relatively small amount.
So remind me again, how many, you're freezing these positions or you're eliminating the positions?
We are not filling positions, Commissioner, that are
Okay.
open. We're not laying anybody off or
Right.
letting anyone go.
And how many positions?
We've had 2 supervisors and probably 5 to 6 positions that we have not replaced.
Okay. Sorry.
So I wanted to also mention, just to give you a quick update before we turn time over to Christine, and just to give you an idea of how many times Kootenai County residents touch Panhandle Health District. And this is all in your packet. In 2021, we did 717 septic permits, 988 food inspections, 120 child care inspections. We monitor 80 public water systems. In addition to that, we had 6,765 people come to our clinical services in 2021. We made 2,789 home visits. Again, home visits are for those individuals that are out of surgery. They're either getting a medical checkup or we have therapists going into their home. Almost 23,000 touched our Women's, Infants, and Children's program in 2021. Our Nurse Family Partnership, these are for young moms. We made 766 visits. Parents as Teachers, a similar program, 2029. Totaling 35,500 touches of Panhandle Health District in the year of 2021. This does not include investigating 978 communicable diseases, and this is less COVID. We have 285 people that went through our tobacco cessation program, 109 women that we were able to assist them with getting breast screening and cervical screenings. In dental, we had 405 participants get sealants, 513 got varnishes. And our wonderful Senior Companion Program, 222 of Kootenai County residents enjoyed that wonderful program, along with our other senior service, our Fit and Fall program, 1,141 class participants in those programs. And of course, there's the work that's really growing for us now, and that's our substance use disorder program, as we're seeing these opioid settlement funds coming into us. And of course, there's our suicide prevention work that we have. And we have our walk coming on September 9th, with over 500 people participate with that. So I wanted just to give you a quick snapshot of the number of folks that are taking advantage of the services at Panhandle Health District. So I'm going to stop there and take any questions that you have before we turn some time over to Christine.
No, Bill, anything? Okay. Guess we can get right into the budget.
Okay.
Good morning. We can start with page 2 of the presentation. This is simply a review of the county funding. If you recall, the allocation is based on 70% of population and 30% on property valuation. On page 3, This is the budget as a whole. So we can see that fiscal year '22 started out with a budget of $14,190,985. Last week, during our Board of Health meeting, we had a budget revision with a net effect to the fiscal year '22 budget of $150,000. The reason for this budget revision was we made a large principal payment, which was board approved. It had been discussed last fiscal year, but we took action in fiscal year '22, actually in August of 2021, where we paid $750,000 off, or excuse me, $725,000 on the, in total, on the Sandpoint facility that was paid off, and then a large principal payment of $680,000 on the Hayden facility. That budget revision brought the fiscal year '22 budget to $14,340,985, a net change of $150,000. The fiscal year '23 budget is $13,029,778. This is a decrease of $1,311,000, or a 9% decrease. If we go to page 5, what I'd like to do in presenting what has a more accurate comparison, I would like to focus on page 5, as this is more of a standard year's comparison. We've removed all activity related to we've removed all activity related to COVID-19 out of the fiscal year '22 numbers so that it better compares with fiscal year '23, as there are no COVID-related numbers other than just general vaccines. No pandemic response, emergency response numbers are included in fiscal year '23. So if we do a standard year comparison, what we see is in total, our personnel costs increased by 8%. In total dollars, those personnel costs increase by $687,020. Our operating expenditures decrease by $71,000, and our capital expenditures decrease by $178,574, and our trustee payments decrease by $70,000, for a net change in our budget of $367,209. Keep in mind that that net change is primarily due to the increase in personnel cost. When we discuss our expenditures, what's occurring and why it's decreased by $71,000, in fiscal year '22, we had one-time costs. For example, in fiscal year '23, we are not going to do a computer refresh, which is about $81,000. And we're not refreshing this year to save money, but simply because through analysis, it was determined that it's not needed. We do have items in stock in case something fails. So that's an $81,000 between the 2 years. The other thing that occurred is last year, fiscal year '22, there was budgeted approximately $40,000 for a new phone system. That's not in this current budget. We also anticipate there should be about a $30,000 savings each year as a result of that new phone system. So those are some of the larger numbers as to why we have a decrease in our operating expense for fiscal year '23 over fiscal year '22. Capital expenditures. What we have in capital expenditures for fiscal year '23, we have approximately $36,000 related to a new truck and trailer for the ICP program, Institutional Controls Program, in the Silver Valley. What we need to remember is that the Institutional Controls Program is 100% funded. There are no district dollars that go into that, but we do need to include their expenditures in our budget. Last year, we had $50,000, basically 2 vehicles, included in the fiscal year 22 budget. We are not budgeting for any vehicles in fiscal year 23. Last year, we had included $100,000 for security systems in 2 outlying counties. Those are not included in this budget. What we do have included in the budget for fiscal year 23 is a upgrade to the network system. That is approximately $22,000, roughly. So those are the changes related to capital expenditures. When we look at our revenues, we're anticipating that we will have level funding related to our grants. We're not anticipating any significant decreases or significant increases. What we did not include in the budget is anything that we were unsure of. There's much discussion related to opioid funding, if that's going to be coming to the districts, that sort of thing. Because of the uncertainty, those amounts are not in the budget. Licenses and fees as it relates to environmental health, we're anticipating an increase of $71,000. Basically, we budgeted based on fiscal year 22, current year's activity, and last week the board approved an increase to certain environmental health fees. That's been included in this budget. Health services, we're anticipating an increase of $192,000. We're anticipating a slight increase related to our clinical division. We're anticipating that patient care will return to normal after COVID. We're anticipating a slight increase for the administrative fees that we can receive from any COVID vaccine, which has been integrated into the clinic. Home health, we're anticipating that we can get back to a normal level of client visits. This past year, we have been under budget in those revenues due to staffing, where we've had to turn away referrals from the hospital. So we're anticipating that in fiscal year 23, we will not need to do that. As I mentioned, we anticipate reasonable level funding as it relates to our grants and contracts. The increase of $41,000 in donations and others is specifically related to the rentals. We're renting space in several of the outlying offices. Those outlying offices would be the Sandpoint facility, St. Mary's, and Kellogg. Interest, that was a rough estimate. Last year it was over budgeted. This year it actually may be under budgeted. It is a $12,000 decrease over prior year. You can see in the county general aid line the change of $37,133. That is the 3% ask on that county general aid component, bringing the total ask to $1,275,000. The House Bill 316 component of the county funding is $1,222,000. That's a stable amount based on fiscal year 21's appropriation. Overall, that's an $814,800 increase over prior year The reason for that is in fiscal year '22, the counties were only responsible for 4 months of House Bill 316. This fiscal year '23 budget represents the 12 months. If we look at page 6, this shows the population and valuation change between fiscal year '23 and fiscal year '22. We can see in population, there's an increase of 12,628 units, an increase of 7.55%. Valuation increased by $4,023,984,127, an increase of 17.73%. The source data for this information is noted down in the lower left-hand corner. Page 7. So we take the population and the valuation, and this is the allocation formula on page 7. The first 1/3 is calculating the general aid component. The second, the middle section, is the House Bill 316 component. The last third at the base of the page is the sum of the two components, the total county ask. We can see that Kootenai County, the total ask, is $1,685,546. That's a change of $501,443 over prior year. Next page, page 8. Basically the same data, same information, but it includes the billing schedule by quarter for the county clerks. So each quarter, Kootenai County's quarterly portion will be $421,387. One page that we did not look at was page 4, which is simply the pie chart of our funding, of our revenues. You can see that 36% of our revenue comes from fees, 44% comes from contracts and grants, 1% is interest and other, such as the rents I mentioned, 9% is related to county funding from House Bill 316, and 10% is the general aid component of county funding. Are there any questions?
Good job.
I have one. The 500,000 increase, is that because that has to do with the 4 months from last year, and so now it's
Yeah.
Yes.
Because it was
Okay.
last year was partial.
just making sure?
Well, that, and keep in mind, you know, the shift in population and valuation, yes.
Right.
Christine, where's the figure again that shows our quarterly payment?
That would be
Page 7, was it?
on page 8, the second half to the right. Last third, towards the bottom of the page.
Oh, there it is, the 421,
421.
385, okay. Oh. Thank you.
So I don't know if the audience has questions.
Any questions?
Yes.
Okay. Bill, anything?
No, nothing.
Good job.
So we'll just have to talk internally and see how we're going to come up with this money, because, you know, the increase, our 3% increases only allow us so much, and natural new growth and stuff like that. So I think we have some creative ways to help with that.
And the sheriff already took 1%.
Yeah, yeah, so, yeah, the other thing that I always get concerned with is we're supposed to be approving, the funding, and if we can't give our employees an 8% raise, but yet we're approving an 8% raise for Panhandle Health, I always have to, consider that during budget season, if that makes sense.
Yeah, absolutely. I understand that dilemma.
And we have way more than a 10% turnover rate countywide. So I think our departments alone were 18%.
We were up there.
Yeah,
Yeah. Yeah, our salaries overall went 8%. Not everyone is getting an
Correct.
8%
Yeah.
increase in their salary. They would like that, but not everyone is, so.
sure. And will you have a breakout for us? Like, what's going to line staff versus supervisors and stuff like that?
Well, clearly, we have a detailed report of who is getting raises. And if that's of interest to you, we could certainly provide that to you,
Okay.
Commissioner.
That's interesting. Yeah, I don't know that I need to see that, but that's still a valid point because it's unlikely that we're going to be able to give average increases of 8% in the county. Wish we could, and you're right, that's where the CPI is indicating.
Yeah, and just remember, Commissioner, we're still 10% below the average, right? We're at 90% of policy. We hope that stems the tide.
Sure.
So are we, by the way.
Yes,
Yeah,
It's
It's
a
everywhere.
universal issue.
yes, sir.
Anything else?
not related to the budget. No, I think I'm,
Bill, nothing? Anyone else? No? I can formally request public comment.
anybody on the phone line?
No one's on the phone line?
Nope.
Okay, then, I've got 10:34. Meeting is adjourned. Thank you.
Thank you,
Thank you.
Commissioners. Appreciate you hearing us out.